Welcome back to CBS This Morning. Pharmacies like CVS and Walgreens will help administer the coronavirus vaccine first to long-term care residents and staff, and eventually to all of us in the general public. Now, Walmart and Sam's Club are also preparing their pharmacies for the big rollout. Their first doses left Pfizer's Michigan plant yesterday. I just love looking at the trucks rolling. Errol Barnett is at a CVS in Troy, Michigan. That's outside Detroit. With more on the story. Errol, good morning to you. So when will nursing homes start receiving the actual vaccine?
Yeah, good morning, Gail. We all love seeing this get going. Well, CVS and Walgreens have made an agreement with the federal government to pick up the baton now and distribute this vaccine to high priority groups across the country. But this race is happening so quickly, there is some confusion about exactly when these most vulnerable groups will get their first doses of the vaccine. And nursing home staff and residents are among that group.
Vaccinations can't happen a moment too soon, not a day too soon.
Dr. Richard Pfeiffer is the head of Genesis, one of the largest U.S. nursing home operators.
Genesis Healthcare.
Genesis is working with CVS to get nursing home residents and staff at its more than 300 facilities nationwide vaccinated.
Tell us how you are coordinating with CVS to get vaccines to all of your people.
CVS's job is supply chain. They're going to make sure that the vaccine gets to where it needs to go. They're going to bring in the vaccinators and the technicians.
So we're shipping 2.9 million doses.
On Face the Nation Sunday, Health and Human Services Secretary Alex Azar said as soon as the vaccines are received this week, they can be administered. But CBS News obtained two documents from Operation Warp Speed, the federal government's vaccine program. They make it clear vaccines can only be administered after December 21st. A full week from today. Former FDA Commissioner Dr. Scott Gottlieb suggested Sunday that's likely because Operation Warp Speed didn't obtain consent in advance from nursing home residents or their families to be vaccinated.
It's a very costly delay. There's 50,000 new infections in nursing homes every week right now, probably more than that.
More than 76,000 residents in long-term care facilities have died from COVID-19 and nearly 1,200 staff members.
We trust that the vaccine supplies are getting out extraordinarily quickly.
While some might see the use of CVS and Walgreens to roll this out as really fast and efficient, you're cautioning that it could actually lead to bumps down the road.
I guarantee you it will lead to bumps down the road.
Dr. Michael Wasserman is immediate past president of the California Association of Long-Term Care Medicine.
The federal government sort of handing the distribution of the vaccine for nursing homes to CVS and Walgreens was not really well thought out. We're anticipating a lot of chaos in the process.
Last week, LA County pulled out of the federal vaccine program, instructing nursing facilities to take on their own vaccine administration, a move Wasserman encouraged.
This really needs to be coordinated at the facility level.
Now, a senior administration official explains to us that the delay was in part because they couldn't request was approved, but they also advised that some healthcare workers and staff may receive the vaccine before next week on Monday. And if you are wondering when you may be able to get access to this vaccine, keep in mind this first wave of doses is just for frontline workers. The rest of us, Anthony, are not likely to have access to this for a few months, maybe even the spring or summer.
All right, Errol, thank you.